I just have a couple of slides, I think kind of iconic slides that have come out of the recent IPCC project, and but I'll show those at the end. I just wanted to comment on a few things. Somebody raised this important point about population, and this is a good entree into the issue of framing, because it's been difficult to include population as a variable, as rather instead of a fixed thing. The IPCC scenarios, for example, don't include any option to control fertility. That's not part of it. They take the UN population projections as fixed. And so, but of course they're not. We know that that there's big changes possible in fertility patterns, even without population control, words to avoid, but just providing access to reproductive health services, however you want to say it, to a large, hundreds of millions of women who want them. Every woman in this room can control her fertility all to 100%. Why shouldn't every woman in the world have that access to that? And there has been research. I was a co-author of a big paper, a modeling effort out of EASA, PNAS, and it shows it makes a big difference. You can make a 30% difference in CO2 emissions by the end of the century by providing access to reproductive health services. Now, name me something else you can do that. I mean, you have to get rid of all the coal in the world to do that. That's a big number. But it's very difficult to get into these assessments. I mean, if you'll find it, so I don't know the person who asked that question, maybe she left, but if you look in chapter 11 of the new working group 2 of the fifth assessment, you have to say so many numbers again. Which is going to be published in a month or so. We've just finished the page proofs. But you can get the pre-publication version on the web now if you like. It's not changed that much. We did manage to keep a section in on the co-benefits section, which Tony did not put in his slide, of access to reproductive health services as a co-benefit situation. Now, what's the co-benefits? Well, the climate side is clear, less CO2 emissions by the end of the century. Now, we haven't done the modeling on that for methane and black carbon and the other greenhouse gases, but it has been done for CO2. What's the health benefit? Well, the health benefit is spacing childbirth. There's a major benefit for maternal health, and there's a major benefit for infant mortality or child mortality by spacing out births. And there are data on this. There are studies. They're not randomized trials. A lot of them are based on demographic and health surveys. I mean, so where, it depends on what level of evidence you want to include. There's certainly physiological evidence for this, why a woman who is getting pregnant every 9 months or whatever, 10 months, a year, is likely to have higher mortality. And then there's social reasons. Who wants to control their fertility? It's not women who are 25. It's women who are 15 or 45 or 40. And those are the groups that have the high maternal mortality rates. But that is, and then since it mentions the 3 big assessments I was involved with recently, IPCC, we barely kept it in. It almost got removed during the government review process the last week in Yokohama. Because, well, people are uncomfortable with, we didn't say population control, of course, but people are uncomfortable. And then the global energy assessment. I was also the convening lead author for the health chapter of that. We put it in there, and the executive council wanted to take it out. I won't say which countries the people were in that, were trying to put it out. We managed to keep it just a paragraph in that. Now, the global burden of disease, however, this is the health people, they took it out. So there's no risk factor, calculated for provision, getting people access to reproductive health services. Anyway, so and that is an important issue. So what is the framing? When we look at the future, is it is that population off the table as a variable? Is urbanization off the table, or we just assume that Southeast Asia is going to urbanize, on its own, and that has nothing to do with this? It makes a big difference in how you do these assessments. What the framing is. So let me talk about just some other issues. I mean, climate change in us, we can beat ourselves for not looking at it in the health field as much as we should have. But, in the past, of course, we did look at, nobody does an air pollution study without measuring temperature or any other studies, but what we did is control for it, right? Because you didn't think it was it wasn't a controllable variable. I mean, who does a study of the risk of gravity? I mean, gravity probably has a lot of risks, right? I mean, if we had less gravity, we might have, probably some positive effects. Nobody does that. It would be stupid because we don't know, there's no control of them. But now all of a sudden we realize we are controlling climate. It is not just something to control for in our analysis. The travesty in the way we don't feed people, don't provide food security. In 2050, well, there'll probably be less food production because of climate change. But we'll still have enough food to feed everybody. But will we feed everybody? No, we won't be feeding everybody. But how much won't we be feeding everybody by then? So the impact, if you will, of going out to 2050 is, yes, the climate change, you say, signal, but also the baseline. How much do you think the world is going to get together to provide food security for the poor? Or income for the poor, or, whatever. I don't know. But the increment, which is the impact of climate change, is actually just as much a factor of, trying to figure out what happens with climate change and food as it is to what happens to the world food system. And as you know, if you've ever looked into this, famine is not a function of food supply, it's a function of poverty, or price, cost gets out of line for poor people. And so the complications of figuring out the impact of food production loss declines, which I'm sure is going to happen, and actual poverty, actual malnutrition. Nobody in this room is going to die of malnutrition. You might be paying more for something or other, but nobody's going to. But you go down the income line, and at some point, it is going to affect people. But society could get its act together and essentially eliminate all of that. But are we going to? No. But how much aren't we going to? That's a difficult question in this baseline of this, this period of the planning horizon period. That's a very difficult question. Now, the other side to it, as Tony kind of alluded to this, is the background health conditions. I say, climate change, typical kind of relative risk might be, you might double the child deaths from diarrhea, in some time and some. All right, you double child deaths from diarrhea in Berkeley, where I live, and you might have to wait 3 years to see one death, probably wait 10 years. You double child deaths from diarrhea in Zimbabwe.